Priyanka, welcome back to the show. Now this has been a very enlightening episode. I'm sure it's been the same for you at home as well, but it's been like that for me in the studio. And Dr. Mehta has been just telling us about some of the statistics that are there, and it's just real hard, solid facts that are available for anyone to pursue if they're interested in this topic. And it's just the fact that maybe we are not interested enough to go out there and see what the situation is actually like. But it's great that there are people like Birendra, who is on the show with us today, and he's great. He's a young gentleman. He's 15 years old, and he's here to address this topic of violence against women. And before we speak to you about the special event that you have planned, I have to ask Carol. Now, you've been in the field. You're an activist. You've spoken to some of these women, and what do you think is the situation from the woman's perspective or a girl child's perspective? What do you think needs to change in that mindset?
I think I brought this up before. Actually, there are some steps that we can actually take. Leave the statistics aside, on how we change how we deal with bringing up children. I blame mothers quite often, because I mean, quite often women tend to go out and say, you know, men are X, Y, and Z. However, I think if mothers who play a dominant role in bringing up children in their homes, in our kind of Asian culture, I think mothers bring up sons to think they are the king of the house, and you know that they shouldn't do any chores around the house. You know, discipline is very important, and the same as you have chores for girl children, if they have chores for boy children, maybe part of this boredom and you know what, the sense of entitlement that boy children have because of the way they are brought up at home to think that they are something special and girls are not. I think that is something we women have to address in a more constructive manner. You know, teach your children that they are equal to each other. You know, teach your boy children and girl children the same, and give them the wherewithal where you think, you know, that they know what is right and wrong. Dr. Mehta spoke about impunity. I mean, that is huge. You know, that is more in line for what is happening in certain countries where the judicial system doesn't play an active role. I mean, there are so many cases in court that have not been heard for years. And then, you know, these children, you know, even in cases of child abuse, where the case is dragged on for years, they need to be fast-tracked so that they are dealt with in a manner that when a girl child is an adult with their own children, they don't have to go to court to testify against. I mean, Dr. Mehta gave statistics on abuse and rape. I mean, they don't, 16 years later, there was a case that came up recently, 16 years later, this young girl is married and has children of her own. They don't want to come and talk about these issues at that point. It's something they have to get over and have a more productive life themselves, you know. So also it's a kind of a cycle. If you grow up in a home where violence is perpetrated, then male children think, you know, they hate their father and they don't, you know, they're going to do something, you know, abusive to their parent when they grow up and protect their mother. But then they grow up and they sometimes become the perpetrator unless they break the cycle of this violence. And then girl children in homes like that grow up to be Dr. Mehta also brought up mental state. I mean, this not only to the woman, this also is perpetrated on the children because their mental psyche is broken down, their sense of you know, being confident is broken down, and a child who is not confident is left open to abuse also, because they are shy and retiring. More likely that perpetrators go after that shy and retiring child. So there's so many things that affect the home environment when violence is perpetrated in homes, and majority of the time it's a known or a family member or a relative who perpetrates this violence.
Of course, it's just so many cycles that need to be broken when it comes to addressing something like this. But Dr. Mehta, if I could ask you now, is it something about Asian countries or African countries, an issue that affects our that side of the world most, or does Western style of thinking affect it as well? How does that balance happen?
Okay, thank you. This report that has just come out, that is the WHO report on the status of violence against women, the first this thing, has given the breakdown by the different regions. And what it has shown is that intimate partner violence, that is IPV, is our region, that is Southeast Asia region, is one of the highest. That is about, from the data that is available, it is about 38%. This is followed by the Eastern Mediterranean region, which is about 37%, and then it is the African region, which is about 35% or so. So if you look at it on a global basis, violence against women occurs everywhere. It occurs in the developing countries, it occurs in the developed countries. They take different forms in the developed countries, and it takes different forms in the developing countries. Now let us come down to Asia. We are all in Asia. Sri Lanka is in Asia, and Asia has its own ethos, its own culture, its own values, its own customs. Now we are a patriarchal society, mainly in Asia and especially Southeast Asia. It is a patriarchal society where the woman is a very caring lady. She is the provider in the house, and always the male or the husband is always comes first in terms of looking after, in terms of feeding, in terms of health-seeking behavior, etc. This is part and parcel of the Asian culture. Now you have to take this into consideration also, that the resilience and the tolerance of the Asian woman is very high, because if a man pushes a woman in the Western world, this would not at all be tolerated. However, in our Asian context, the woman is educated right from the time she is a child by the mother that it is okay, and this is also part of the culture where they have a lot of tolerance to abuse or anything like that. So that has to be taken into consideration. Now what Carol was talking about is very important, because you have to look at it as a life course approach. One very important fact, which is scientifically proved, there are so many papers published, that an individual who is abused as a child is 2 times more likely to abuse when he becomes an adolescent or an adult. It's very clear, it is a vicious circle. So a person who has been brought up in a verbally abused family, physically abused family, financially abused family, will definitely have predilection more to abuse when he grows up, and that cycle repeats very much so. Now we are talking all on the negative side. Let us talk now on the positive side, right?
All right.
Because I am very privileged to work in your country for the past 5 years, and I am very proud of all the development, the investment in the social sector of education and health in your country, and Sri Lanka stands out as a developing country, that is a lower middle income country, stands out of doing so much with so little. If you take the Millennium Developmental Goals, if you take the indicators, Sri Lanka is far ahead than most of its neighbors, with, even though it had a 30-year civil strife in these past 30 years. Now, violence against women is nothing new in Sri Lanka, nor is it new in the Asian context. However, this has not been talked about overtly. In the 5 years that I have been over here, Now is when my Honorable Minister, Mr. Maithripala Sirisena, openly talks on this. The Ministry of Women's Affairs and Child Development is the nodal ministry who are taking a lot of efforts on this. In the UN, we have five UN agencies have a 3-year project which is focusing on violence against women. The Ministry of Health is the health sector is the entry point for violence against women, because a woman who is physically abused or psychologically abused lands up usually for help physically or otherwise to a hospital or a health center.
Yes.
So I'm very happy to tell you that most of the hospitals have GBV desks. It is called gender-based violence desks, and this is married or in collaboration with several NGOs. And Carol was just telling me that she is one of the founder members of Women in Need, which is the leading NGO on this gender-based violence. Then Women in Need have come out, have done an excellent research study on case study of 790 women who have undergone violence and their profiles, which has been done. Then there are several grassroots level organizations who are working on empowering mothers at village level to say no to violence against women. And one more thing, Amaya, that you have to understand, Birinder doesn't represent the normal youth of this country. Birinder is the privileged 15% who lives in an urban situation. In your country, 85% of the population lives in rural areas. They are underprivileged. They don't have the luxury of going to international schools, etc., etc. But I see excellent grassroots level work done by Rajaratha University.
Yes.
There is a health promotion division over there. I have worked with them and I have seen their work, where they are promoting a healthy and a happy village concept through the primary health care midwife. They are empowering the mothers to look and address bone navana, that is non-communicable disease, child development, nutritional issues, and violence against women, and alcohol, where women are now being empowered and they get together and they say that there is zero tolerance and we are not going to tolerate you hitting us.